Question 1. The nurse is demonstrating to a new unlicensed assistive personnel, UAP, how to apply anti-embolism stockings. When is the correct time to apply the stockings? B. Before getting out of bed in the morning. Anti-embolic stockings should be applied before blood can pool in the lower extremities, at the ankle and calf areas. The best time is before the client gets out of bed in the morning. If this isn't possible, the client should lie down with their legs propped on pillows for at least 15 minutes before applying the stockings. The stockings are usually worn during the day, although the healthcare provider may order them to be worn at all times. Question 2. A client returns to the unit after abdominal surgery. While monitoring the client, the nurse observes a moderate amount of red blood on the dressing. The nurse will document this type of wound drainage as A. Sanguineous. The nurse will document this drainage as sanguineous. The word comes from the Latin, meaning blood. Wound drainage is described by type, color, amount, and odor. Types of drainage are 1. Serous, clear and thin, may be present in a healthy, healing wound. 2. Serosanguineous, containing blood, may also be present in a healthy, healing wound. 3. Sanguineous, primarily blood. 4. Purulent, thick, white, and pus-like, may be indicative of infection and should be cultured. The amount of drainage is generally documented as absent, scant, minimal, moderate, large, or copious. The presence and degree of odor can be documented as absent, mild, or foul. Foul odors can be indicative of an infection. Question 3. The nurse is planning care for a client with status post-CVA and limited mobility. The client is scheduled for occupational therapy at 10 a.m. and physical therapy at 2 p.m. What times are most appropriate for nursing care? B. AM care at 0800, PM care at 1600. Clients who are recovering from a serious condition and have limited mobility require extra time. Not only do they need more time to prepare and to move, but they also need more time to rest before and after therapy sessions. The only correct option is to provide AM care at 0800 and PM care at 1600. Question 4. After a high school athlete sustains a fractured femur during a competition, a 4-leg plaster cast is applied. When the nurse provides discharge instructions to the athlete and their parents 6 hours later, which statement by the athlete indicates a need for further education? A. I should walk around on my cast as soon as I get home. Plaster casts are made up of a bandage and a hard covering, usually plaster of Paris. Client instructions include: 1. Keep the limb raised on a soft surface, such as a pillow, for as long as possible in the first few days. This will help any swelling to go down. 2. Keep the cast dry. If the plaster gets wet, it weakens and is unable to support the bone. 3. Do not put anything into the cast to relieve itching. This can damage the skin and cause an infection. A hairdryer set on cool or an ice pack over the itchy area can help. 4. Immediately report any pain, tingling, or numbness, or if the toes turn blue or white. Question 5. A pediatric patient has been diagnosed with right lower lobe pneumonia. Upon auscultation of this lung field, the healthcare provider should expect to hear which breath sounds. B. Crackles. Crackles would most likely be heard because they indicate fluid in the airspace. Fluid in the airspace is consistent with pneumonia. Wheezes indicate a narrowing of the airways. Stridor is an emergency lung sound that is seen in airway constriction that can lead to complete closure. Rhonchi are heard in mixed tissue airway constriction and secretions. Question 6. When taking the blood pressure of a client who is seated, which position must the client change so that the nurse can get an accurate measurement? B. Uncross the legs. The nurse should ask the client to uncross their legs because the position can compress blood vessels and affect the accuracy of the reading. The other positions do not affect circulation or the measurement. Question 7. The Wong-Baker Faces Pain Rating Scale can be used by all of the following except B. Parents and caregivers. The Wong-Baker Faces Pain Scale is a self-assessment tool that is understood by the patient, so they can choose the face that best matches their physical pain. It is not to be used by a third person, parents, caregivers, or healthcare professionals to assess the patient's pain. It was originally created for use with children, so they could communicate about their pain. It is now used around the world for people ages 3 and older. Wong-Baker Faces Pain Scale used with permission. Question 8. A patient with a diagnosis of lung cancer is receiving chemotherapy. The patient reports nausea and loss of appetite, resulting in decreased food intake. What should the healthcare provider recommend to the patient to promote adequate nutrition? B. Eat small meals throughout the day. Because of chemotherapy-induced nausea, the patient may not feel hungry, but they should be encouraged to eat even if not hungry. Encouraging the patient to eat small meals frequently throughout the day can help avoid nutritional deficiencies and improve the patient's quality of life. Chemotherapy can cause changes in smell or taste. Aversion to favorite foods can result. Question 9. During their annual physical examination, a client tells the nurse that they have dry, hard stools every 3 days. Which of the following will be most helpful in improving the client's bowel movements? B. Drink at least 4 glasses of liquids a day. The most common cause of hard stools is lack of adequate water to combine with the waste products and undigested food in the large intestine. There can be other causes, including medication side effects, intestinal disorders, and slow motility through the large intestine. Clients should drink at least 4 8-ounce glasses of water a day. Fiber will also be helpful, but is not the first remedy. Too much fiber can cause bloating and abdominal pain. Exercise is also important in stimulating the bowel. All the other options are helpful in avoiding constipation. Question 10. Despite frequent turning and skin assessment, occasional urinary incontinence has caused a bedridden resident to develop a reddened and tender area on the coccyx. The resident weighs 192 pounds. Which pressure relieving device should be used for the client? B. Alternating overlay. For clients who weigh less than 250 pounds, an alternating pressure overlay is the best choice because it is liquid resistant. It has compartments that alternately inflate and deflate to relieve pressure. Foam and sheepskin surfaces are not appropriate for clients with urinary incontinence. A low air loss bed is ideal but expensive, and it can cause hypothermia if not carefully monitored. Question 11. A 10-year-old boy is admitted to the pediatric unit with a diagnosis of viral meningitis. He is experiencing a severe headache, a stiff neck, vomiting, photophobia, and drowsiness. The nurse can make him more comfortable by C. Closing the shades and dimming the lights. The first action should be to alleviate the photophobia by darkening the room. This may alleviate the child's headache also. Deep breathing can be useful but will not eliminate the discomfort of meningitis symptoms. Fluid balance is important but not the first priority. A large, soft pillow may place the neck in an awkward position and exacerbate the child's discomfort by stretching the meninges. Question 12. The home health nurse notices that a client with a diagnosis of multiple sclerosis is recently having difficulty chewing and swallowing. What is the appropriate diet for this client? A. Mechanical soft. A mechanical soft diet has a consistency that the client may be able to handle. This diet should be tried first. A full liquid diet can be challenging for a client with poor swallowing. Pured foods can cause the client to regress or feel embarrassed. A clear liquid diet is not indicated and does not supply sufficient calories. Question 13. To measure an adult client's apical heart rate, where does the nurse place the stethoscope? A. Fifth left intercostal space at midclavicular line. Film equals fifth intercostal midclavicular line. The apical pulse and NBSB is auscultated with a stethoscope over the chest and NBSB, where and NBSB, the heart's mitral valve is and NBSB, best and NBSB, heard. For adults, the point of maximum pulse is the fifth left intercostal space at the midclavicular line. In infants and young children, the apical pulse is located at the fourth intercostal space at the left midclavicular line. Question 14. The nurse prepares a 5-year-old girl for a preoperative for insertion. Which statement is most appropriate to reduce the child's anxiety? C. Tell me if this feels more like a pinch or a bug bite. Like all clients, children should be prepared for procedures. Educate them, but don't suggest that there will be pain. Allow them to decide if there is discomfort. Ignoring an explanation or trying to distract the child is rude and interferes with the child's sense of trust. Question 15. The nurse is providing post-mortem care for a client who was being treated for Staphylococcus aureus. Which transmission-based precautions are indicated? B. Contact precautions. MRSA is transmitted by contact, and MRSA bacteria remain alive for up to 3 days after the host dies. Therefore, contact precautions must still be used after the client dies, including the use of a gown and gloves. The body and bag should also be labeled as MRSA contaminated so other hospital, transportation, and funeral home employees can protect themselves as well. Question 16. A patient receiving chemotherapy is experiencing stomatitis. Which of the following should the healthcare provider offer the patient? B. Warm saline rinses 4 times each day. Stomatitis is irritation of the lips, mouth, tongue, and oropharynx, which occurs when chemotherapy kills healthy cells that are rapidly dividing. It can impair nutrition, speech, sleep, and the quality of life. Warm saline rinses are non-irritating and help eliminate bacteria that can cause infection. Other nursing interventions include gentle oral hygiene and administration of a topical analgesic as ordered by the physician. Question 17. A client with end-stage renal disease has opted for an arteriovenous (AV) fistula for long-term treatment with hemodialysis. Following the surgical creation of the AV fistula, when will the client be able to use it for hemodialysis? A. 2 to 3 months. An AV fistula is a connection of an artery to a vein, created by a vascular surgeon. An NBSB, AV fistula and NBSB, frequently requires 2 to 3 months to develop or mature, and NBSB. Before and NBSB, the patient can use it and NBSB for long-term hemodialysis. Question 18. Which meal best promotes healing for a patient recovering from a burn injury? A. Chicken breast, strawberries, milk. The meal with the best nutrition for wound healing includes protein and vitamin C. Foods that have low nutritional value, such as sugar or those with low or no calories, are not beneficial. Question 19. Which lab value indicates hypokalemia? A. 3.2 MEQL. The normal serum potassium K range is 3.5 to 5.0 MEQL. For this question, the only correct option is 3.2 MEQL. Hypokalemia is associated with an increased risk of cardiac arrhythmias. The nurse should report this result immediately and be prepared to administer a potassium supplement. Question 20. A patient with a total hip replacement requires certain equipment for recovery. Which of the following will assist the patient with activities of daily living, ADL? A. High-seat commode. A high-seat commode keeps the hip higher than the knee. A recliner is helpful because it prevents 90 degrees flexion, but it is not necessary for activities of daily living, ADL. A TENS, transcutaneous electrical nerve stimulation, unit helps with pain management, and an abduction pillow is used to prevent hip adduction and possibly dislocation of the prosthesis, but neither are part of ADL. Question 21. The nurse is providing education for a client who has just been prescribed a transcutaneous electrical nerve stimulation (TENS) unit for relief of chronic back pain. Which of the following instructions to the client is correct? A. Don't go to sleep with the TENS unit on. TENS relieves acute and chronic pain by using a mild electrical current that stimulates nerve fibers to block the transmission of pain impulses to the brain. The current is delivered through electrodes placed on the skin at points determined to be related to the pain. Clients should not go to sleep with the TENS unit on. Clients are typically instructed to use the TENS unit for 30 to 60 minutes at a time, depending on the type of pain. TENS may result in instant and possibly prolonged pain relief. Muscle twitching may indicate overstimulation. Question 22. As part of a preoperative prep, the nurse is administering a cleansing enema to an adult client. After positioning the client on their left side and lubricating the tip of the rectal tube, how far should the nurse insert the rectal tube? A. 3 to 4 inches, 7.5 to 10 centimeters. In an adult, the anal sphincter is 1 to 2 inches, 2.5 to 5 centimeters, past the anal orifice. The tip of the rectal tube should be inserted 2 to 3 inches, 5 to 7.5 centimeters, to ensure that the enema fluid enters the rectum, for a total of 3 to 4 inches, 7.5 to 10 centimeters. The purpose of a cleansing enema is to gently flush the colon. It can be used prior to a surgical procedure, medical examination, or colonoscopy. It can also relieve constipation, fatigue, and some backaches. Question 23. A nurse working at a long-term care facility is observing a new client. Which of the following signs indicates that the client may have a vitamin B2, riboflavin, deficiency? A. Mouth sores. Vitamin B2, also called riboflavin, is an NBSB, one of 8 B vitamins. Signs of deficiency include cracks and sores at the corner of the mouth, fatigue, digestive problems, swollen, magenta-colored tongue, itchy and burning eyes, and sensitivity to light. B2 deficiency has been linked to cataracts and migraine headaches. All B vitamins help the body to convert food, carbohydrates, into glucose, used to produce energy. They also help the nervous system function properly. The B vitamins, often referred to as B-complex vitamins, also help the body metabolize fats and proteins. B vitamins are water-soluble, so the body does not store them. Bruising is a sign of vitamin C deficiency, scurvy. Night blindness indicates vitamin A deficiency. Muscle cramps, aches, or weakness indicate a vitamin D deficiency. Question 24. The nurse is providing perineal care to an uncircumcised client who is in a coma. Which of the following is correct regarding the perineal care? B. Retract the foreskin all the way back. When providing perineal care for an uncircumcised client, pull the foreskin of the penis all the way back to the head. Go around the urinary opening in a circular fashion, down to the shaft of the penis. This ensures that all bacteria, sweat, and other debris are fully removed from their perineal area. Return the foreskin to its natural position. The penis is washed before the scrotum, then the anal area, so additional washcloths are not usually needed. Sterile solutions are not used. Question 25. Contraindications for administering an enema include all of the following except A. Hypocalcemia treatment. An enema may be used to administer sodium polystyrene sulfonate, Eclectrolyte, for the treatment of hyperkalemia. Eclectrolyte can be administered either orally or as an enema. Sodium polystyrene sulfonate is not absorbed from the gastrointestinal tract. As the resin passes through the gastrointestinal tract, the resin removes the potassium ions by exchanging them for sodium ions. Recent colon surgery, acute myocardial infarction, and suspected appendicitis are contraindications for administering an enema. With elderly clients, enemas should be used with caution because of their higher risk of hyperphosphatemia, perforation, and sepsis. Question 26. A client with chronic renal failure, CRF, is learning to perform peritoneal dialysis at home. The nurse instructs the client to warm the dialyzing solution to 37 degrees Celsius so that it will C. Dilate the peritoneal blood vessels. The rationale for warming the peritoneal dialysis solution is that the warm solution helps dilate peritoneal vessels, which increases urea clearance. Warm dialyzing solution also contributes to client comfort by preventing cold sensations, but this is a secondary reason for warming the solution. The other options are incorrect. Question 27. A new client at the long-term care facility has experienced a recent loss of vision. Tells the nurse that they are bored. Which activity is best for the nurse to suggest? A. Listening to audiobooks. The client with a new loss of vision can use their sense of hearing to enjoy listening to audiobooks or the radio. Joining a group can be overwhelming or intimidating for someone with new loss of vision. Many crafts, such as basket weaving, knitting, or working with clay, can be therapeutic for the client after they have adapted to their condition. Learning to read in Braille requires special instruction and practice. Question 28. What is the smallest gauge intravenous catheter that can be used to administer blood? B. 20 gauge. An 18 gauge needle or catheter is generally used to administer blood or push fluids, or for testing protocols that require large 4 bores. However, a 20 gauge is acceptable if the facility's policy allows it. This size is better for clients with small veins. A 22 gauge is used for falls of short duration or for clients who are not critically ill. Usually, blood cannot be administered because of hemolysis of the RBCs. A 24 gauge is used for pediatrics and adults who cannot tolerate a larger gauge. A 16 gauge is mostly used in intensive care and surgery units because most fluids and blood products can be quickly administered. 26 gauge needles are used for injections. Question 29. Of the following positions, which one facilitates maximum air exchange? B. Orthopneic. Orthopneic, sitting in a leaning position, allows for the most lung expansion. High Fowlers can help, but it isn't as effective as the orthopneic position. Trendelenburg is used for hypertension or low cardiac output. Lithotomy is used for vaginal examinations and childbirth. Question 30. When instructing a patient with Addison's disease about nutrition, the healthcare provider should not recommend which of the following dietary modifications? A. A restricted sodium diet. A patient with Addison's disease, adrenal insufficiency, requires normal dietary sodium to maintain electrolyte balance and prevent excess fluid loss. The patient should be instructed to maintain adequate caloric intake with a diet high in protein and complex carbohydrates, including grains. Question 31. When a patient's nasogastric (NG) tube stops draining, what is the nurse's first action? B. Check tube placement. Always verify tube placement before taking other measures. Never put anything in an NG tube unless you know that its tip is in the stomach. Clamping has no effect on NG tube placement. Retracting without knowing where the tip is would be unsafe for the patient. Question 32. A client comes to the clinic, complaining of severe gastrointestinal distress. Which abdominal physical assessment step does the nurse do first? A. Inspection. The correct sequence for physical assessment of the abdomen is as follows: 1. Inspect. 2. Auscultate. 3. Percuss. 4. Palpate. Remember this sequence with the phrase "I am a people person." The order is different from the physical assessment of the body systems, for which you inspect, then palpate, percuss, and auscultate. Question 33. The palliative care nurse is caring for a client with advanced multiple myeloma. Which intervention is most appropriate? A. Use gentle repositioning techniques. Multiple myeloma occurs when abnormal plasma cells, myeloma cells, collect in several bones. In 70% of multiple myeloma cases, the bones develop multiple holes, called osteolytic lesions. Multiple myeloma may also affect other tissues and organs, especially the kidneys. This type of cancer causes hypercalcemia, renal failure, anemia, and bone damage. Multiple myeloma can cause erosion of bone mass and fractures. Extra care should be taken when moving or positioning a client because of the risk of pathological fractures. Pain is intense from the bones and nerves and should be treated. Fluid hydration of 3 L daily is recommended throughout the disease course and improves overall survival. Question 34. The nurse is caring for a pediatric client in a Spica cast. All of the following are true except B. Assist the client to ambulate several times a day. Spica body casts are used to immobilize the femur and pelvis. The cast holds the joint above the hip, the spine, and the joint below the hip, the knee, still, so that the femur and pelvic bones are unable to move. Skin should be checked for sores, around the edges and inside the cast. Large meals can cause an uncomfortable feeling, so meals should be small. Repositioning is crucial. Use pillows, blankets, and cushions. Do not allow the heels to rest on surfaces, to avoid pressure sores. Ambulation is not permitted when wearing a Spica cast. Question 35. After emptying a Jackson-Pratt drainage bulb, how does the nurse re-establish negative pressure in the system? C. Compress the bulb and close the valve. A Jackson-Pratt drain creates negative pressure when the bulb is compressed and the valve is closed. This causes fluid around the surgical site to flow into the drain. Question 36. A client with a diagnosis of multiple sclerosis is learning to walk with a cane. Which of the following instructions regarding safety is correct? A. Move the cane at the same time as the weak side. A standard cane is generally appropriate for people with mild sensory, coordination, or balance problems. And NBSB. To safely use a cane, 1. Hold the cane on the stronger side of body, or the stronger leg. 2. Position the cane slightly to the side and a few inches forward. 3. Be sure the cane is not close to the feet to avoid tripping. 4. Move the cane forward simultaneously with the weaker side of the body or weaker leg. 5. Plant the cane firmly on the ground before stepping forward with the stronger leg. Question 37. The nurse is educating the parents of a young child with a recent diagnosis of cystic fibrosis. The nurse tells the parents that the child will be at risk for which vitamin deficiencies? A, D, and K. People with cystic fibrosis have trouble absorbing fats, which means they also have trouble absorbing vitamins that need fat to be absorbed: A, D, E, and K. These fat-soluble vitamins are critical to normal growth and good nutrition. B-complex, C, folic acid, biotin, and pantothenic acid are water-soluble and easily absorbed. Question 38. The nurse is preparing to transfer a client with a recent cerebrovascular accident, CVA, from their bed to a wheelchair. The client has left-sided hemiplegia. What is the proper position for the wheelchair to ensure a safe transfer? A. Parallel to the bed on the client's right side. The wheelchair should be placed parallel to the bed on the client's unaffected side. In this case, on the client's right side. Once the client is standing, they can easily pivot until their back is toward the wheelchair and they can reach for the armrest of the wheelchair with their unaffected arm. A perpendicular position requires the client to reach farther for the armrest. Until the client has mastered the skill, 2 people should assist. The wheelchair should be locked for stability. The client should wear non-slip socks or footwear. Question 39. A patient diagnosed with Crohn's disease has a new colostomy. When assessing the patient's stoma, which of these would alert the healthcare provider that the stoma has retracted? C. Concave and bowl-shaped. A colostomy is created when the bowel is pulled through an opening in the abdominal wall, creating a stoma through which intestinal contents will pass. A healthy stoma will protrude about 2.5 centimeters with an open lumen at the top. The stoma should appear pinkish red and moist. A dry, dusky, or reddish-purple stoma indicates ischemia. A narrowed, flattened, or constricted stoma indicates stenosis. A concave and bowl-shaped stoma has retracted. A retracted stoma can be difficult to care for. Complications include problems maintaining appliance placement, leading to leakage and sore skin. Question 40. The healthcare provider is preparing a patient for a total colectomy and the placement of an ileostomy. The patient asks where the stoma will be located. The healthcare provider identifies which of the following areas as the correct stoma site. B, C. A total colectomy involves the removal of the large intestine. The gastrointestinal output will occur at the terminal end of the ileum. The stoma will be located in the right lower quadrant of the abdomen. A total colectomy is performed for intestinal inflammatory conditions such as Crohn's disease or ulcerative colitis. It may also be done for severe chronic constipation.